Your child has a fever, but we did not find a serious cause for it on this visit. A fever is the body's natural reaction to an illness, such as infections due to a virus or bacteria. In most cases, the temperature itself is not harmful, as it actually helps the body fight infections. The most common cause for fevers in children are viral infections that typically get better after a few days. We will go over this in more detail later in the video, but it is important to remember that if your child has a daily fever for over 5 days, or if your child looks very uncomfortable or is not eating or drinking anything, it is important to seek medical attention. Otherwise, fevers can be treated at home. At home, keep clothing to a minimum because excess body heat needs to be lost through the skin. Fevers tend to increase if you dress your child in extra layers or if you wrap your child in blankets. When measuring your child's temperature, keep in mind that rectal, forehead, or armpit temperatures are best for children under 6 months old. For children 6 months to 4 years, you can also try using an ear thermometer. Children above 4 years can start using an oral thermometer. Fevers increase water loss from the body. For infants under 1 year old, continue regular feedings, either formula or breast milk. Between feedings, you can add on an oral rehydration solution such as Pedialyte. You can find this at most grocery stores or drugstores without a prescription. For children 1 year or older, give plenty of fluids such as water, juice, soft drinks such as ginger ale or lemonade, or ice pops. Diluting juice with water can also be used as a substitute for the oral rehydration solution. If your child does not want to eat solid foods, it is okay for a few days as long as he or she drinks lots of fluids. Keep children with fever at home resting or playing quietly. Encourage frequent naps. Your child may return to daycare or school when the fever is gone and she or he is eating well and feeling better. Periods of sleeplessness and irritability are common. If your child is congested, try having him or her sleep with the head and upper body raised up. Monitor how your child is acting and feeling. If she or he is active and alert and is eating and drinking, there is no need to give fever medicine. If your child becomes less and less active and looks and acts sick, and his or her temperature is 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, you may give acetaminophen. In infants 6 months or older, you may use ibuprofen instead or with acetaminophen. Aspirin should never be given to anyone under 18 years of age. If you are giving your child acetaminophen or Tylenol, you can give it to him or her every 4 hours. If you are using ibuprofen, you can give it every 6 hours. For fevers that seem high, you can also alternate between acetaminophen and ibuprofen every 3 hours. For example, if your child gets a dose of acetaminophen at 9 a.m., you can give a dose of ibuprofen at noon, and then another dose of acetaminophen at 3 p.m., and so on and so forth. You do not have to wake up your child to redose the medicine if your child is sleeping through the night. Follow up with your child's pediatrician within 2 to 3 days of visiting the emergency department. Unless your child's healthcare provider advises otherwise, call right away or go to the emergency department if any of these occur. Your baby seems fussy or cries and cannot be soothed. Your child seems to be breathing much faster than normal. Your child is wheezing or is having difficulty breathing. Your child has an earache, sinus pain, stiff or painful neck, or headache. Your child has abdominal pain or any pain that is not getting better after 8 hours. Your child has repeated diarrhea or vomiting. Your child has unusual fussiness, drowsiness or confusion, weakness or dizziness. Your child develops a rash that is unusual for them. The fever lasts 5 days or more. You should also seek medical attention if your child shows any signs of dehydration, including no tears when crying, sunken eyes or a dry mouth, no wet diapers for 8 hours in infants or decreased urination in older children, or if your child has a convulsion or seizure. Please contact your healthcare provider immediately with any additional questions. Thank you.